In this presentation, we'll be covering the general concepts of basic life support in children and infants. You'll find that the processes are much the same between children and infants. The compression to breath ratio is the same for both children and infants. If there's just one rescuer at the scene, the compression to breath ratio is 30:2. If there's two, the ratio is 15:2, with one rescuer doing compressions and the other doing breaths. We'll start with basic life support for children. Note that a child is considered anywhere between age 1 and puberty. With one rescuer, we have a cycle of 7 steps. The first step is to determine if the victim is responsive by shaking them or shouting at them. Step 2 is to assess if they are breathing. This can be done by either putting your ear up to the victim's mouth or watching the chest. Step 3 is to yell for help if he or she is not responding or breathing. If someone responds, you would send him or her to get an AED, and it would essentially change to 2 rescuer basic life support. Step 4 is checking the child's pulse, but for no more than 10 seconds. You could do this with either the carotid pulse on the side of the neck or the femoral pulse on the inner thigh and the crease between their leg and groin. Step 5. If there's no pulse, or you can't tell, begin CPR with a 30:2 compression to breath ratio. If the pulse is less than 60 beats per minute, still initiate CPR. Compression depth should be about a third of the chest, so for most children, this is about 2 inches. Step 6. If after 2 minutes or 5 cycles of CPR, no help has arrived, leave the child to call EMS and get an AED. Step 7 is to use the AED. We'll go more into depth about AED use in another section. For now, just know to follow the AED steps and continue CPR until EMS arrives, or until the child comes around. Next, we'll do 2 rescuer BLS for children. You'll find that the process is very similar. Step 1 is to shake and shout at the victim to determine responsiveness, just like Step 1 was for one rescuer. Step 2. Assess if they are breathing. If the child isn't responding or breathing, send the second person to activate the emergency response system and get an AED. Step 4. Check either the carotid or femoral pulse, but make sure not to waste time doing it longer than 10 seconds. Step 5 is to begin CPR. If there was insufficient or no pulse, if the second rescuer has not returned, do 30:2 ratio CPR. When the second rescuer returns, begin 15:2 CPR, with one doing the 15 compressions, followed by the other doing the 2 breaths. Step 7 is to use the AED and follow the prompts. Continue this and CPR until EMS arrives or the child's condition normalizes. Next, we'll go into basic life support for infants, which are considered to be from birth to age 1. We'll go over the process, starting with one rescuer. Like with children, Step 1 is to shake and shout at the victim to determine if they are responsive. Step 2, assess if they are breathing. If the child is not breathing or responding, yell for help. If someone responds, send him or her to call EMS and to get an AED, in which case you would be doing 2 rescuer basic life support. Assuming no one responds, feel for the infant's femoral or brachial pulse for no more than 10 seconds. Then initiate CPR. Of course, only if there is little to no pulse. The infant should be face up on a hard surface. Using 2 fingers, do compressions in the center of the infant's chest, but make sure not to injure the infant by pressing on the end of the sternum. Compression depth should be about 1.5 inches, and at least 100 per minute. Step 6. Leave the infant to call EMS and get an AED after doing CPR for 2 minutes or 5 cycles. Like always, use the AED and follow its prompts, and continue CPR until EMS arrives or the infant's condition normalizes. 2 rescuer basic life support for infants is only slightly different. First, you'll want to shake and shout for a response. Then assess their breathing. If there's no response and no breathing, send the second person to call EMS and get an AED. Feel for the infant's brachial pulse for no more than 10 seconds. Begin CPR by doing 30 compressions and 2 breaths until the second rescuer returns. Once the second rescuer returns, you'll switch from 30 to 2 to 15 to 2, with one rescuer doing the compressions and the other doing the breaths. If the second person can fit their hands around the infant's chest, perform CPR using the 2-thumb encircling hands method. Once again, do not press on the bottom end of the sternum, as this can cause injury to the infant. Make sure your compressions are 1.5 inches deep and at a rate of at least 100 per minute. Lastly, use the AED and follow its prompts while continuing CPR until EMS arrives at the scene. Here is the algorithm for infants and children. Go ahead and pause here if you need to take a look at this for a moment longer. And that concludes BLS for children and infants. Next, we'll go into pediatric advanced life support. Thank you.